Hello everyone, my name is NweNandar, and today I will be presenting my health science Capstone project. My project examines emergency preparedness knowledge among young adults, focusing on differences between medical and non-medical populations using a cross-sectional survey design. Okay, let's start. Emergency situations such as stroke, choking, and anaphylaxis are time-sensitive events where early recognition and immediate action can significantly reduce morbidity and mortality. In many real-life situations, the first person to respond is not a medical professional, but a peer or a bystander. Because of this, emergency preparedness knowledge should be viewed as a population-level public health concern rather than solely a clinical responsibility. This project focuses on young adults aged 18 to 28, a group often assumed to be healthy and therefore overlooked in emergency preparedness initiatives, despite their frequent presence in public and social settings. Regarding the literature review, it consistently shows gaps in public emergency knowledge across multiple domains. Studies on stroke recognition demonstrate that many individuals fail to identify fast symptoms, leading to delay in seeking care. Similar gaps are observed in choking emergency, where awareness of the Hamish maneuver does not always translate into correct execution. Moreover, research on anaphylaxis shows low confidence and hesitation in using epinephrine autoinjectors even when individuals recognize the symptoms. Importantly, individuals with medical or health-related education consistently demonstrate higher emergency preparedness compared to non-medical populations, highlighting a preventable health disparity. These findings support the need to systematically assess emergency preparedness knowledge among young adults, particularly across different educational backgrounds. This project is guided by a logic model framework which provides a structured approach to planning and evaluation. Inputs include existing literature, survey tools, and participant recruitment platforms. Activities involve administering an online questionnaire and analyzing collected data. Outputs include descriptive and comparative findings on emergency preparedness knowledge. Short-term outcomes focuses on identifying knowledge gaps, while long-term outcomes aim to inform future educational intervention and public health strategies. This framework ensures alignment between project goals, methods, and intended outcomes. This study will use a cross-sectional survey design to assess emergency preparedness knowledge at a single point in time. Data will be collected using an online questionnaire distributed via Google Forms, which is appropriate for young adults due to its accessibility, cost-effectiveness, and ability to ensure anonymity. Participants include young adults aged 18 to 28, divided into medical and non-medical groups. The survey will also include sections on stroke recognition, choking response, anaphylaxis awareness, emergency contact knowledge, and self-reported confidence. Convenience sampling will be used, and its limitation will be acknowledged in the interpretation of the findings. As for the data analysis plan, quantitative data will be analyzed using descriptive statistics to summarize knowledge levels across emergency domains. Inferential tests such as chi-square and independent t-tests will be used to compare medical and non-medical participants. Open-ended responses, where we analyze thematically to explore barriers such as fear, hesitation, or lack of confidence. This mixed approach allows for both numerical comparison and deeper contextual understanding of emergency response behaviors. As this is a proposed study, findings are framed as expected outcomes. It is anticipated that non-medical young adults will demonstrate significantly lower emergency preparedness knowledge compared to their medical counterparts. Knowledge gaps are expected to be vary by emergency type, with particularly low confidence in practical response skills. These findings would highlight emergency preparedness as a modifiable and equitable public health issue. In conclusion, this project frames emergency preparedness knowledge as a critical component of health equity and community safety. By identifying disparities between medical and non-medical young adults, the findings can inform targeted educational interventions, policy development, and community-based training programs. Ultimately, improving emergency preparedness among young adults has the potential to reduce preventable harm and strengthen population-level resilience. These are my references for my project. Thank you so much for listening. Have a nice day, everyone, and Happy New Year. Bye bye.